Good morning, everyone. My name's Gavin Lockhart. For those who don't know me, I'm Assistant Director of Programmes with NHS England Mental Health Clinical Delivery Team covering the South East, and I've been involved in various capacities with mental health support teams from very early on in their inception. So it's an absolute privilege to be here and to be able to introduce the event today. So a couple of quick bits of housekeeping, and then I just want to say a few introductory words, and we'll run through what you can expect from the next couple of hours. So please do put yourself on mute. We've already experienced some echo, so we know that we'll get some issues if people aren't on mute. So make sure you're on mute, and if you can turn off your cameras until the Q&A sessions, that just helps with the bandwidth for everyone. But please do come back off camera in the breakout sessions. It's really nice for everyone to be able to see each other as well as hear each other. And please do use the chat bar. I think at the previous events that we've had, there's always been a very active conversation in the chat bar. So we would really encourage people to use that to share any questions or comments. And I'm sure that will be captured as part of the write-up from the event. So as I say, it's an absolute privilege to be able to introduce yet another one of these events from the Kent, Surrey and Sussex Academic Health Science Network. So Robin, Beck and I, we've known each other for a number of years, and we've all shared very similar passion around this subject area. So we've known now for several decades that schools
I think that's everybody in there.
Oh, is someone on? Oh. I think someone's got their microphone on still. Thank you. Yeah, so we've known for several decades now that schools are a really significant resilience factor for young people, where there are wider contextual factors that might leave them at risk for mental health problems, but equally that schools can sometimes act as trigger factors or factors that exacerbate mental health problems for children and young people. For those who haven't seen it, NHS Digital published some updated prevalence figures on children and young people's mental health last year. And what was interesting was within it, they looked at the percentage of young people with probable mental health difficulties or disorders who had sought help or whose families had sought help. And they found that 75% of families of young people between under 18 in their sample with a probable mental health disorder had sought help. So that's fantastic. We've got 3/4 of families of young people who may well be experiencing mental health disorders who are seeking help. The most interesting element of that was then where they sought help from. So 68% of those families sought help or advice from the school in the first instance, and school was the #1 ranked source of seeking help or advice, and was 23% higher than the next ranked source of support or advice. So that's really significant. And in their sample, although we know mental health support teams currently don't cover 17 to 18s, the 17 to 18-year-old cohort were most likely to seek help or advice from peers in the first instance. So I think that just is another confirmation that it absolutely makes sense to have mental health support embedded in the school environment. And that gives us a really good opportunity to normalise mental health, to influence cultures around mental health, and to prevent mental ill health, as well as to support early identification and intervention. So mental health support teams are a really key element of that. They're not the whole picture, but they're a really key element and policy driver over the last few years. Mental health support teams were set up with 3 functions. So one was to deliver direct interventions, early intervention to young people with mild to moderate difficulties. The second was to support a whole school approach. And the third was to support and facilitate onward referral for those young people with more complex or severe difficulties. It's really positive that the whole school approach is captured in the quarterly reporting that every system in the country is now having to submit to NHS England nationally in terms of their progress around mental health and the mental health of children and young people. And it's really critical that we continue to measure and evidence the impact and the value added of the whole school approach work of mental health support teams, and to be able to then pull out best practice. So our colleagues at Kent, Surrey and Sussex AHSN have been absolute forerunners and pioneers and champions for this from the get-go. So, and we're delighted to have been associated with their work, and we're really excited to hear about this next phase of their work around whole school approach and mental health support teams. So we've got a really good agenda lined up for the next couple of hours. So we're going to hear from the national team first off, and then we're going to just have an update, a reminder of the best practice review and evaluation that was conducted by the AHSM before moving into developing the whole school approach outcome measures, which, as I say, are really critical to us understanding the impact and value added and identifying best practice. Then it's going to be really good to hear from a number of sites in terms of their approach to the whole school approach and the impact of that. And as I said earlier, we're going to have some time for breakout rooms just to hear about some of your local practice and enablers and barriers to that. So I hope that you enjoy the event, and I will hand over to Laura, who is our first speaker.
Hi, morning everyone. Thank you so much for allowing me to come along this morning. So I'm briefly going to run through some work that we've been doing to help MHSTs capture their Function 2 and Function 3 activity. So we've led this within the national team, which is where I work for NHS England, and it's a piece of work that we've done in conjunction with a number of willing volunteers from MHSTs and also some regions as well. So if we skip along to the next slide. So a little bit of background, we set up this piece of work for a number of reasons, kind of really clearly highlighted in bold there on screen for you. But the biggest reason was that we had some really strong feedback from MHSTs that said it'd be really good if we could have some national guidance that would just help us increase the visibility and consistency of understanding around delivery of the whole school and college approach, Function 2, and also Function 3, as Gavin outlined, which is around the signposting and liaison. And we're really aware nationally that we did have quite a limited understanding around the themes that were emerging from delivering those two functions. And we know that the MHSDS, the Mental Health Services dataset, is really, really limited. So we wanted to support services with this. And the third trigger was, if anyone read it, some lovely bedtime reading, was the interim evaluation report. Also indicated that actually there was a really good opportunity where we could enable MHSTs across the country to be able to capture the breadth of their activity more consistently. So they were the reasons. And if we skip to the next slide, please. Thank you. So what we wanted to do, we wanted to respond to MHSTs requesting for some national guidance. And just to reiterate, if anyone is familiar with the quarterly monitoring process, this is completely separate. This doesn't replace the quarterly monitoring that we do, nor is this a new national quarterly data collection. This is purely about helping sites capture their Function 2 and Function 3 activities. And along with that, with this guidance, we want to set out a minimum expectation, a minimum standard about what data and intelligence could be collected, how it could be used, and making sure that whatever we did put in place as a recommendation really took into consideration the associated workload that comes with capturing, submitting, reviewing, analysing, etc. And along with that, we also wanted just to produce a sample data collection template, which MHSTs can use if they wish. So three aims: it was the guidance, a minimum expectation, and also to develop a sample template. So next slide, please. So this is really small, and don't worry because the slides can be shared, but it was just highlighting the approach that we took. As I've mentioned at the start, we pulled together a multi-agency working group made up of national, regional and local MHST colleagues. And we undertook a scoping exercise. So I think whatever we wanted to produce, we really wanted to make sure that it fitted with current practice that we knew was out there. So a really good number of teams responded to the scoping exercise and shared with us what they are currently capturing and how they were capturing. So we reviewed the information, and out of that we identified the most common things that teams were already recording, and they were used to inform the minimum expectations that we set out. They were approved by our programme board back in July, which then brings on September, which is where we are. So just yesterday at the MHST Community of Practice, we launched the guidance, and really kind of I'm able just to reiterate a few points here this morning. So going forward, Q3, giving a full quarter for MHSTs to review the guidance, adapt their local processes and mechanisms as they can. Then hopefully in Q4, that can be the first quarter in which all MHSTs up and down the country are able to consistently capture these minimum standards that we are suggesting all around function 2 and function 3. Next slide. So just really briefly on screen, these are the headline items that we are recommending that MHSTs collect. As I've mentioned, they are all based on the scoping exercise for what teams are in general already capturing. So around function 2, which is that delivery, supporting the whole school and college approach, things such as the type of activity, the topic, the audience, the numbers involved, and obviously really important the education setting, if they've already got an action plan. And really keen as well to suggest that when activities are delivered, that they are evaluated. Next steps are also put into place. But these slides are circular, so I won't go through them in too much detail. So if we go to the next one. This next slide is what we talk about as a minimum for capturing function 3. So that's that signpost and liaison offer. And again, these are just headline items, all in the context of pre-referral, if it's relating to a particular child or young person. Naturally, if it's post-referral, it would go onto the mental health services data set. So again, here we looked at the scoping and looked at the common things that teams were already collecting. It may or not be around a specific child or young person. So we do suggest to collect the nature of the request and what the outcome of the advice or the signposting was as well. So next slide. We're also going to pop into place, hopefully next year, a national survey. So we mentioned at the beginning, nationally, our understanding of delivery of function 2 and function 3 is a little bit limited. And we're really keen to see not just numbers, because numbers are available there in the quarterly monitoring, but just understanding what the needs are of children and young people. So to identify those needs so we can keep in tune with what frontline experience is actually like, we are proposing a voluntary annual survey, a bit of a snapshot stock take of just a couple of those headline items that I went through. And that really is about enhancing the visibility and understanding of our delivery so we can put in the best response as possible to help you deliver those functions. So later on this year, the working group's going to come back together and then we hope to be able to launch the first survey early in 2023-24 when teams have had time to put in place those minimum recommendations, and it'll all be based upon that. I think also just to note, in 24-25, so another year into the future, and that's the point at which we anticipate the funding for established MHSTs, so Trailblazers through to Wave 10, that funding will continue. It'll just go into a different pot and it'll go into the baseline pot. So people that may be familiar with how funding works at the moment, the MHST funding is classed like transformation funding, so it goes in the transformation pot. Come 24-25, the funding will continue, you'll still get it, but you'll go into the baseline pot. Any expansion, I always get asked this, any expansion beyond Wave 10, so let's call it Wave 11 onwards, is still absolutely down to funding settlements. We've just got a new government in place, so let's see what they decide in terms of the future expansion as well. But hopefully that helps with just a little bit of confidence. I know we've said it a number of times, but the funding will continue. It will just go into a different pot for you. But that, circling background, national survey, that's what we hope to put into place early in 23-24. So again, we can just understand more about the delivery of those really two important functions. So next slide. And just quickly tagging onto the timeline. So I mentioned before, September is where we are now. We've shared the guidance and we've had a webinar around that. Q3, MHSTs can establish their processes. Q4, they can start to use and capture that information. And in 2023-24, that's hopefully we can launch that first annual snapshot survey. Again, really want to keep it short, meaningful, so we can get a good response from teams. And the next slide. Oh, that was where I finished. So well prepared. Anyway, thank you so much. If there's any questions, please do just pop them in the chat and I'll try and pick them up.
Laura, thank you so much. It's always so good at these events to have the national update to just set the context as we go forward. And as I said in my introduction, and you fleshed out just now, it's really, really positive to see the developments in terms of capturing functions 2 and 3 in the MHSTs, which are just as critical as function 1. So that's a really great start to this event. I'll hand over to Robin now, who's going to run us through the evaluation from last year, and then I think smoothly segue into updates in terms of evaluating whole school approach.
That's the plan. Thank you very much, Gavin.
Thanks,
it's absolute pleasure to be with you all today. I'm going to try and see if the computer is going to play ball, and I'm going to share my screen now. Let's see if this works. Okay, can I just get a quick check that this is working?
Yeah, we can see it, Robin. Thank you.
Fantastic. Thank you so much. Okay, everybody. So I'm delighted to be here. My name is Robin Banerjee. I'm a professor of developmental psychology, specializing in the social and emotional development of children and young people. And I'm also the head of the School of Psychology, one of the biggest schools of psychology in the country. And I've been absolutely delighted to work on this project, which I think is really complementary to everything that Laura was talking about, because alongside the really important work that MHSTs are doing and all the team is working on in terms of capturing the wonderful activity that's taking place, we wanted to understand, really get underneath the skin of the whole school approach. And so we did a piece of work with this wonderful team that you can see listed here. A lot of great people came together to work on this. Really trying to make sense of what is happening in schools, what are the practices, what's the best practices that we can identify, and recognizing that really we're on a journey with all of this. We need to do more to understand what's going on with whole school approach, and that journey is still with us. But we've gained a lot of insights from this. What I'm going to do over the next 20 minutes or so is just give a little bit of a summary of what came through that work on the best practice review of whole school approaches. This was mainly in the southeast and east of England, but I think the messages here actually carry forward through to national level as well. Now, the best practice review was actually quite an intense piece of work. We were doing a lot of work in a relatively short space of time, really under a year, but we got an awful lot done because we had a wonderful team. And we had a number of different strands of work. And the first was actually, as you often do with a project, a really good literature review. Now, this wasn't intended to be like a comprehensive, systematic review of absolutely everything, but what we wanted to do was to just try and synthesize the key things which were coming out of the literature. And of course, we were tapping into the Public Health England wheel of many different dimensions of whole school approaches. And what came through was the really strong support in the literature for all of those different issues. And you've got some of them here. That targeted support goes hand in hand on the left-hand side. Targeted support goes hand in hand with a positive ethos and environment that promotes respect and values diversity. And that in turn is not the same as, but is related to a positive curriculum with teaching and learning that can actually promote resilience and, importantly, support what we call now, over the last 30 years, we call it SEL, social and emotional learning. And then there's that really important point of engaging all the different stakeholders as well. That student voice is really important, really getting parents and carers on board. And of course, very importantly, engaging all the staff. That this isn't just something which is just a few specialist staff in a school. It's not just a pastoral team. It's not just a well-being team. It's everybody. And when you do that, you begin to realize, actually, this isn't just about the kids. This is about the whole school community, which means we need to support staff members' own well-being as well. And so one of the things that came through the literature review, though, was how do all of these different pieces fit together across the full developmental lifespan? So many things are going on in schools. So much work on anti-bullying, supporting well-being, promoting mental health, work on emotional literacy, social and emotional skills development. How does it all fit together, and what does it look like in the context of MHSTs? Well, one thing that you've got highlighted on this slide is the voice of the students themselves, and we actually took that forward with a discrete piece of work, which Ian McDonald did a wonderful job at the Charlie Waller Trust. And we had a very creative classroom activity. These are some of the outputs that came from the kids. They worked in groups. At a classroom level, we had primary schools and secondary school classrooms took part in this, and we had many, many outputs from this work, which gave us an insight into how young people themselves were thinking about mental health support in the schools. Just like Gavin was saying, school is a really, really important place for young people's mental health, and often is the first port of call when difficulties are arising. So what really matters from the point of view of the young people? Well, these are the things which came out as the most important themes. And you'll see the one in the top left there, ethos. Now, the overall ethos of the school, the climate, the culture of the school, is not just about the formal support and the formal processes. It's also about just interpersonal relationships. Most of the groups talked about teachers. Pastoral staff, yes, but also their friends. And like Gavin was saying, that increases as you get older. The importance of the friendship group as they develop more and more intimate relationships with more self-disclosure, which is a common developmental pattern, you start to see that the peer context is really important. Then you have to ask your question, how does that relate to everything else that's going on with the MHST work on whole school approaches? How does it link to the curriculum? How does it link to all the targeted work that's being done with individuals who've been identified as at risk? How does it relate to all the staff development work that's going on? Well, building on this, we also had some really nice quantitative data coming from the monitoring reports, the data returns that MHSTs very kindly provided to us, and we added some materials to that, and we were so pleased that the MHSTs really helped us pilot some new things, and I think is really testament to the fact that the MHSTs were all feeling, all the staff and the schools were feeling like this really matters. We need to try and pin down some of the things which sometimes feel very intangible. So this was one of the things we did. At the end of the Q3 analysis, this is back the previous year when we were doing the work, as part of that, there was a series of open-ended questions about whole school approaches, but then we also created, on the back of that and the work that had been done with the literature review, informed by the pupil voice work as well, we also did a set of standardized ratings about different aspects of whole school approaches. And this is very much a pilot piece of work. It was building on work that we've done, I've published in this area in relation to whole school approaches to social and emotional skills development. And what we did was we asked MHSTs and schools, you can see 22 MHSTs and 28 schools, to do ratings like these. We took 17 different implementation dimensions. This is one of them. This was all about student voice. And we just asked the experts, if you like, the MHSTs themselves and the schools to give us an honest self-evaluation of where they are at in terms of the development of whole school approaches. So this was, in a way, a kind of a zoomed out way of capturing how schools and how MHSTs were feeling about where they have got to with whole school approach activity. Now, I don't have time to go through all the details of this, but I thought I'd just summarize. These are the kind of two clusters that we found statistically of dimensions. One set of dimensions, which was orientation and approach, was kind of the underpinnings, if you like, of doing the whole school approach activity. And then another set of dimensions related to intervention and data. And what I thought I'd do just now as a very easy, quick summary is to just point out with some color coding which were the things that people scored highest and lowest on. And this is, of course, in a way, it's a self-evaluation of where are we. And it's not meant to be like a judgment. It's recognizing that this is all part of a journey. Some MHSTs were pretty new, you know, but this is what we found. One which I think was very encouraging was that senior leadership buy-in was felt to be very strong. Not at the highest level, but it was generally scoring higher than other dimensions. And the other thing that was felt to be proceeding well was the work on targeted mental health support. That is typically engaging with young people who are identified as having early indicators of difficulties or risk factors and providing appropriate intervention and support. So those two things, MHSTs felt they were doing reasonably well. So none of them were like right at the top of the scale, but those were ones which were relatively high. The ones which were relatively low, and this speaks to the key issue that we're investigating today, is the 2 points that you see at the bottom. Data collection to identify mental health needs at a whole school level and use of that data to inform mental health work. Well, we really wanted to unpack all of this, and we did a whole range of interviews with staff members, both in the MHSTs and in the schools, to try and understand what was happening. So, as I said, get under the skin of the whole school approach. So I want to just give you a snapshot of what was coming through from that work. First of all, let me just say this right at the outset. There was an overall sense of enthusiasm from all the people we spoke to. And you can see that one quote there. This was from a school staff member. Previously, we've always struggled with the various services. They're always so busy. To have specific support for a child's mental health, which is a pretty broad spectrum, is amazing. And I think we shouldn't kind of take that lightly. We should recognize that's really important, that sense of buy-in, that actually this is really good stuff and we've been missing it, and this is giving us something that gives us confidence. I think that's a really important point. However, the next point, selecting the starting point, is something that I felt anyway when working through the data, and I think as a team we all felt this, was very much like work in progress. And there was a lot of stuff going on, right? As you can see from this quote, right? The seniors and the MHPs are having lots of ad hoc informal conversations, talking about our whole school needs all the time. But how to do that is not so straightforward. And you can see from speaking with people, actually, there's so much learning that's taking place in the course of this work. And this is probably something that can't be manualized in a very simple way, but we need to think about how we can scaffold it in the guidance and the training. This is a one quote from one MHST. What I've learned is every school, even if you're in the same town, is completely different in ethos and culture. And what I learned very quickly is to be curious and non-judgmental, because some of the things that I initially came in and thought weren't working were actually that way for a good reason. So it's like, don't barge in and immediately say, that's not right, we need to fix that. Actually come in with an attitude that is curious and non-judgmental. And I really love that approach to managing the interpersonal dynamics. And I think actually is a really good indication of what we mean by working as a whole school community, because in my view, the MHST is a crucial part of that whole school community, not separate from, together with the whole school community. A few other things that came through. Balancing targeted interventions and the whole school approach. That's a really, really challenging issue. And I think measurement has a lot to do with it, to be honest, because if something feels very intangible, it's not really captured, it doesn't get the same attention, And so actually what can happen is you kind of tip the balance to one function of MHSTs more than another. And I can see that already the work that Laura was describing is going to be really crucial in just in terms of the mental balance between the targeted work and the whole school approaches. But there is something fundamental here in terms of what we're going to do in relation to data, measurement and evidence with respect to whole school approaches. And that's what I'm going to talk about in my last 10 minutes. But let me just say a few words about this idea of finding the right balance and really achieving system change. This was a nice quote which talked about that whole issue of targeted and whole school approaches and how do you get those different functions of the MHSTs to work in an integrated way. In our consultation and liaison meetings, there had been a sense that we would sort out, fix individual cases and problems. But when we've done reflective practice sessions in a school, those dynamics changed. And what's happening now is that staff are bringing a young person's presenting problem and talking about what they're doing to support that young person, saying where they're not sure, saying where they think things are improving. And it's a really interesting dynamic because, like, one of the things which really I wouldn't say it surprised me, but it was interesting to hear it laid out so explicitly, is this idea, and I think it's a false dichotomy, but this idea that there's kind of a binary of whole school approaches over here and targeted work is over here. So this one person said whole school approach is always thinking about the child in context, and as this person saw it, it runs kind of counter to the other function of the MHST around the individual work, where you're sort of locating the problem in the child. Now, I would hope that everyone on this call would feel, actually, those two things shouldn't be counter to each other at all. They should be complementary. It shouldn't be a completely different philosophy behind whole school approach and targeted work. That's where you've got a problem, right? What you need to find is what's the underpinning philosophy that makes sure those two things are integrated. Well, I think one of the ways that we can move forward with it is making improvements in relation to methodology, measurement, capturing the nature of the work and the outcomes of the work. And you can see what one person said here. With regard to the impacts of our whole school approach work, we've been quite aspirational in what we want the impact to be, but we haven't got a good way of effectively measuring that. We'd be looking at the school data and we can't confidently say those results are because of our WSA work, that like attendance has increased or something like that. We can't claim that. We can't attribute to our work. It's just like a correlation at best. So what are we going to do with that? And it's like, you can sense the sort of frustration that people are feeling, that we feel like this is really important work. We have all these high aspirations, but not getting any sense of how we can demonstrate that, yeah, this is valuable and it's making a difference. Now, schools have been doing things, you can see this here, online school system regarding mental health and well-being, school health check and so on. And one of the things that we really want to move on with now is doing a kind of a deep dive into that whole area to really unpack what's going on. We need to see that this work is part of a system change, part of a culture change, and we need to recognize that there are many, many different dimensions to it. It's like one of the things that came out of the literature review, one of the gaps we found was that whole idea of, well, mental health work in schools isn't the only thing that's going on in schools. It's related to a whole bunch of other stuff. And sometimes those different things don't connect with each other so well. Like, look at this one. Right, this is a quote from one of the interviewees. The language around emotion coaching, which was something that they were doing as part of the MHST activity, is not about punishment. But the behavior policy in the school says if a child or young person has done something wrong, they'll be sanctioned. And the language in the behavior policy speaks to a different mindset, as this person saw it. If the two are not aligned, it's difficult for staff to know when to follow one kind of approach to problematic behavior and when to follow the other one. But I really like this this last quote I'm going to share with you, because it shows that this kind of work is amenable to positive change, right? We can make a difference here. And this person said, as teachers, we've become accustomed to being, well, a little bit reactive. Problem comes up, we use our experience to try to deal with the situation. Often you can't get professional advice. One of the big benefits now of the MHST work was, since we've been part of the team, we've got expertise to give us a clear idea of what can be done in certain situations. We've shifted from being reactionary and crisis management to preempting problems. Isn't that great? Now, how do we capture that? Well, just in the 3 minutes I've got left in this section, I just wanted to bring out the point that actually there's some really, really valuable strength in the work here. And it's kind of on us, all of us, nationally as well, I think, to capture this important work. And I think what Laura's describing is really important part of that, but then also capturing the impact of that work quite directly. There are so many things that we found were really crucial foundations for success in relation to MHST. What gives rise to the strength in MHST is those foundations, engaging all the multiple stakeholders, partnership work, tailored approach to supporting staff well-being, connecting the mental health work with everything else in the curriculum, staff development, all of that kind of stuff. But look at that point on the bottom left here, systematic and routine collection and analysis of data on whole school approaches. It feels like that's a real gap. So just to backtrack a little bit, when we launched this report, which when was that? I think it was like December last year. When we launched this report, we set out a number of different recommendations. One is that we've got something good here, and we need to build on it, right? It's not at all like the finished product. It's very clear from all the data returns we had, the quantitative analysis and the qualitative analysis. This is work in progress, but it's important work which has legs, and we need to find a way to get these messages across to make sure there's a sustainable funding commitment to MHSTs. Guidance for staff, absolutely. Engaging multiple stakeholders, as discussed, absolutely. Gathering and collating evidence of the profile of whole school approach work, absolutely. And it's like we're almost beginning to tick that one off with everything that Laura's described. So the kind of the fit with the national agenda there is really, really good. The next one is that idea of making sure that we've got the philosophy of whole school approaches really in sync with what we're doing around individual or targeted interventions, and making sure that we've got a really good workforce development. But the bit that I wanted to focus on was this last one, because I feel like the next stage of our work is this thing, implementation activity. Okay, and capturing that, trying to pin down the intangibles. And one of the most important parts of that is, of course, tapping into the impacts of whole school approaches. So I'm going to use, hopefully I'm still on time, just checking my time. Yeah, so I'm going to try and just segue now into what we want to do next. And I'm absolutely delighted that in our local areas, MHSTs, schools in southeast and east of England are really excited about this next phase of the work, which I think is going to be unfolding over the next 6 or 7 months. Really exciting stuff. And it's all about this. How do we go about measuring whole school approaches to mental health? Really, really big question. And as I said, we got quite a lot of insight into this at a sort of zoomed out level in the best practice review. But out of all the different things that we're looking at, we felt like this is the one where we need to do a bit more of a deep dive. And part of it, as we already heard from Laura, is the work that's being undertaken around measuring the activity itself, actually capturing what people are doing to focus on that function of the MHST. But the bit I want to focus on is that last bit in that activity monitoring, which is the outcomes, right? What are the outcomes of this activity and how can we track that? You know, in the literature review, and there is an extensive literature on whole school approaches, one of the big gaps is actually getting really good data on how the whole school approach itself is developing and making a difference. And we still don't have a good handle on how to capture that. And what I wanted to do over the next 9 minutes is to just give you a little bit of an insight into the different kinds of approaches that we could take to this, and what we will seek to do over the coming month, and we would love to have the input from all of you. You're going to hear right after me from some people who've been doing some wonderful work in this area already, and then hopefully the breakouts will give us even more. Our first question, of course, is what, right? What are we actually going to be trying to capture? And one thing I suppose is straightforward, which is that, well, we just want to, you know, think about the core orientation of the, you know, the whole purpose of the NHSC. So we want to obviously capture the primary mental health outcomes. So that's going to be obviously really important. How do we connect it to the whole school approach? That's a really interesting methodological question. But perhaps we take one step back as well. A lot of what we heard in the best practice review was that there were changes going on that related to the whole school community. Surprise? Of course not, right? That's what a whole school approach should be doing. School climate, school culture, school ethos. Are we capturing that? Are we finding a way to say that, yeah, that is changing? Because we're saying that that needs to change. Everyone is telling us we need to pay attention to this. But how do we know it's making a difference to those things? So we need to figure out whether we can do that. And in fact, there's actually a lot of work that's out there in the literature on these topics. So that's one of the things we're interested in exploring. And then, of course, just to say, this is not going to be like the primary orientation of what we're doing in the next 6 months, because we can't pack everything into such a short space of time. But I just wanted to say, this is a bigger project, right, than just what we do immediately, because we then need to ask ourselves, so what are the mediating mechanisms? So if we are able to find that there are positive changes occurring as a result of the whole school approach activity, what's mediating that? What's carrying that effect, right? What's responsible for it? Are you changing how people are thinking about each other? Are you changing the way people are thinking about themselves? Are you changing the way people think about their, I don't know, their value system? So you've got all of those kinds of things. Are you actually making changes to the physical environment? Is that what's making a difference? And we can begin to unpack that as a kind of a longer term project. And the other thing is moderating factors, because one of the things that came through the best practice review, as you heard from that first quote about, you know, being curious and non-judgmental, is that there are many differences in different settings, and we can't assume that what works in one setting is going to necessarily be what works in another setting. So the moderating factor is another big picture kind of thing that we need to do around when does something work, for whom, under what circumstances. Is it different for this group than for that group? Is it different? I mean, even geographical region, is it going to be different in the this part of the country versus that part of the country? And why is that? So all of those things are, I think, really important for us to look at. We're going to be focusing primarily over the next 6 months and just trying to capture how people are looking at the outcomes of whole school approaches. But I did want to just make the point that there is a bigger piece of work to be done over the long term in terms of mediating and moderating factors. So I'm just going to use the last sort of 5 or 6 minutes to just talk you through the different kinds of things we might do, okay? So there are a few different approaches, and these are not mutually exclusive, and I know for a fact that some schools, some NHSTs are actually doing all 3 of these things. So one of them, which is kind of happening already through the work that's happening with the targeted data, is to aggregate reports on individual events and experience. So you kind of build it from the ground up. You just get lots and lots of individual information, aggregate it at the school level, and you make conclusions about what's going on in that school versus another school. Another thing that you can do is aggregate individual reports on their perceptions of school. And I don't want you to knock it, because yes, perceptions are going to be subjective, but those perceptions really matter to psychology, right? Mental health is very much influenced by our subjective perceptions. That's like sort of, you know, mental health 101, right? This isn't necessarily about, well, what's happening in the objective environment. Actually, perceptions really matter a lot. And we saw that so much when we did the work with the young people themselves. And the last approach that I wanted you to think about is the sort of so-called expert report on whole school approach. And I use that word sort of with my air quotes here, because I want you to be thinking about, right, who are the experts? Can someone come in, investigate and evaluate how good the whole school approach is and what difference it's making. These are all three valid approaches that are used in the literature. And I just wanted to just very quickly run through what they look like. So one of them, of course, which I know is already happening, is just a statistical one, which is just looking at mental health referrals and outcomes for individual children and young people and aggregating that at the school level, aggregating that at the MHST level. Of course, that's happening already. But a big question is, how can you interpret that? Right? How, like the quote at the end that I gave was, how do we know that that's got something to do with the whole school approach as such? And it's really difficult to do that. But nonetheless, it's important context. So that's one thing that you can do. But the next thing that you can do is also aggregating reports on individual events or experiences at school. And this is what we call a formative measure. Okay, so imagine these are all individuals. It could be young people, it could be staff members in a school. And you're asking every one of them to give us their perception on their own life, right? What's happening to them? How do they feel? So, I mean, you could imagine a question about bullying, right? What's your experience of bullying been like? Have you experienced it? What's happened to you? What's your experience of being socially included like? Those kinds of variations as well, right? And what you can do, it's called a formative measure, because effectively, we're not asking the young people about the school, but we're building up a picture of what it's like at a school by getting this information from everyone. So if you think about like a public health survey, I know a lot of areas and local schools do public health surveys where they get thousands and thousands of data points, all about the young people's own direct experience. And you put that together and you've got a really good picture of actually, we've got some big differences. This school, the young people are saying this is what's happening to them. In that school is very different. So that's another way that you can begin to build a picture of what the whole school culture is. However, there's a third thing that you can do, and that is to aggregate individual reports on the perceptions of school. So this is what we call a reflective measure. It's directly reflecting the construct of interest. So if the construct of interest is in the school, we can ask people directly, so tell me, what's your school like? So the evaluation that each young person is making in the measurement is not what is my life like, it's what the school is like. What do you observe to be the culture of the school or the ethos of the school? What do you observe to be the mental health support available in the school? These can be used in conjunction with each other. So these slides that I've just shown, like I want to really emphasize it. Formative measures, reflective measures, statistical aggregations of referrals and clinical outcomes. These are not mutually exclusive. We want to see what is the package that works best. The last thing, of course, is this one, the expert report on whole school approaches. You saw the implementation dimension ratings that we got in the best practice review. Well, what if we were to ask people about outcomes in a similar way and we got people to do that work? Of course, we need to ask the question, who has the expertise? Can we do it on a self-evaluation basis? Can we ask MHST leads themselves? Can we ask school leads themselves to give us honest reflections on what's going on? And then try and map it on to the kind of data that Laura was describing in terms of activity. Do we need to, like I had a paper where we did this work around social and emotional learning. We did expert evaluations, but this time we actually had people going into schools, doing a school tour. They had like a protocol of interviews, observations. All of that was like the foundation for doing the ratings afterward. And that's another possibility that we could look at. So I know that I'm just throwing a lot out there, but I've come to the end of my time. I just want to try and summarize by saying what we're planning to do over the next 6 months is these three things. First of all, gather intelligence on what whole school approach impact measurements are being used already, what approaches, what tools, what instruments, what checklists or audits or whatever. What are people doing already? Look at the validity and reliability. Are these kind of made up scales? Are these kind of passed on by word of mouth? Is there a good basis for the psychometrics in terms of the literature and so on? That's part one. Part two is to co-produce an approach to whole school approach impact measurement, which is realistic, feasible in the time available to really busy people, and importantly, is going to be informative, right? We've got to have those things ticked off. And then importantly, of course, we are packing a lot in here. We also want to pilot the approach in some new settings as well. And let's see where this takes us. I feel like this is a kind of deep dive which is going to be crucial for taking us to the next level in this important work on mental health in schools. But thank you very much for your attention. I'm looking forward so much to seeing what comes out of the breakouts. Thanks.
Robin, thank you so much, and a consummate professional, running exactly to time. That's really a really heartening presentation. There's lots of claps raising up on the screen as we speak. It's so positive and encouraging to hear that systematic approach to trying to develop some evaluation tools to what can sometimes feel quite an intangible concept, whole school approach. So really excited to see where the future takes you with that and to support piloting that in the region. So we've got our next speakers. We have 15 minutes now before our breakout rooms. So we've got some speakers from local areas to tell us and showcase their ways of measuring impact of whole school approaches. So I'll hand over to Lucy, Vic and Anna.
Hi, thank you. Apologies, it's not letting me turn my camera on for some reason. I will continue to try, but you'll be looking at the slides anyway. So I'm Lucy Hill. I am the manager, one of the managers for the mental health support teams, primarily focusing on our whole school approach work at East Sussex County Council. So we've been in place since the Wave 1 teams. I want to throw a disclaimer in, especially after following Robin, that I'm no way an expert of recording and measuring the impact of whole school approach work. And as I've only got 5 minutes, I've just tried to go through the structure of my thinking on why I've got to the point of where we are now in East Sussex in recording this. And you will notice that although I have titled it Measuring Impact of Whole School Approach, actually, I think looking at the impact statements that are in the operational manual, they are very aspirational, and that's really, really good. But to be able to record that, I think I've gone a bit backwards and focused mainly on the outcomes. So I will be talking mainly about outputs and outcomes, and hopefully that will be feeding into, what does that mean in regards to impact. So next slide, please. Thank you. So the first step for me was to have a clear project plan and a clear idea of what we wanted to achieve as a service. So keeping in mind those impact statements that we want to achieve as a mental health support team as a whole, so all 3 functions, and then how can we align our deliverable aspects of our service to those impact statements. So these outcomes here are mainly focused on what can we tangibly measure with the things that we're delivering, like I said, psychoeducation, like the information, advice and guidance we're giving to schools, and drop-in sessions that we're providing to schools, supervision programme that we're providing across the county. We also think that, I also think that, a lot of the work is around the everyday conversations being embedded in the school, and that's the bit that we really find difficult to capture as a team. I think that has a really good impact, the fact that we are in schools, living in that community, breathing that community, feeling it, experiencing it, and having everyday conversations. I think that's the part that I'd really like to bring to life in the work that we're doing. At the moment, I think it could be an administrative nightmare if we try to capture all those conversations, but it is something that I'm thinking about at the moment. Next slide, please. So, nevertheless, about all those other bits that I still want to capture, I do find logic models helpful to, just structure my thinking, and what are the challenges, what is going to impact on recording the outcomes for whole school approach work, that function 2 work, having a really good idea of what our inputs are, what our activities are, and then, working from there. Next slide, please. And then the next thing, is I had a really good look at what is already available. I mean, we do have advantages being situated in a local authority, in the children's services, and particularly in education. So I was able to have a look at what else is around that we can really support our work. So we're not duplicating as well, we're not confusing the schools with lots of different messages about mental health and emotional well-being. And also what data is available. So we have the school sensor data, so I do use that for our equalities work particularly. And we do also have access to the Healthy School programme, which is a real benefit for us as a team, because they do have an online audit tool, which does have the 4 areas that schools can audit. I am specifically looking at the emotional, mental health and emotional well-being section, and I can see, what schools have signed up, the areas that they're rating themselves. So they do grade themselves in the different 8 principles of whole school approach. And then I can see in the back office functions how schools are doing with that and what are their areas for improvement and the actions they're setting themselves. And we can then take that to schools and have a look at how does the mental health support team work complement what actions they're setting. And then we can see, are they managing to change that rating from inadequate, for example, in pupil voice to good or outstanding. Next slide, please. So again, I think I've always been mindful of the local context. You probably all know your local context very well, but I think it does add an additional layer when we're thinking about impact. For East Sussex particularly, we've got therapeutic thinking as an ethos. So there are other teams in East Sussex thinking about this work. So we're threading that ethos through the work that we're doing. And then it's the added layer that we have to think about. It's actually how we then capturing across the whole county, the impact that therapeutic thinking as an initiative on its own and the mental health support team's role within that. We do use data quite well in our team. We do use our service data as well, which I'll go into. I'm running out of time already, a bit more in the next slide. And we do have access to really good equalities data as well. And we do have mental health and emotional wellbeing steering group, which is formed of different services from health and education. And I think that group is really good at holding us all accountable and thinking about what is the needs in schools from the use of our data and from those anecdotal stories that we have as services, and how can we work together to address those, and then how can we measure the impact of what we're doing in that group as well. Next slide, please. So our service data, we probably have the same referral data as you all have access to. We analyse that every month. It's one picture that we say to ourselves can show us elements of what's happening in our service and in schools. So one piece of work that we've done over the last year, which we've managed to track, is that referrals for young men were a lot lower in our service than for females. So we've done a whole host of work to address that with schools, which I would class as a really good example of where clinical practice and the whole school approach work has come together to really address that issue. And we were discussing that with schools all the time, mapping it to individual school data as well and having those discussions, and it has increased this year. Can we claim that it was because of all that work that the referrals have increased? Possibly not. But I think then when we overlay that with the conversations that we're having with schools, that really brings it to life. That actually I think it gives a bit of backing to that data to say, actually, yes, I think we can claim a little bit that actually the work that we've done has made an impact on breaking down the stigma that's surrounded young men's mental health particularly, and because of the focus group work that we did for young boys, we had their voice integrated through that as well. And we do visit schools twice a year, and we take that data to the schools to really go into depth about, okay, what does this say in context to the school and what is the need of the school? And that really helps drive forward our whole school approach work. And we can map that on an individual level in those meetings as well, of what's going well and what's not going well. Next slide, please. So the specific measurement tools.
Lucy, can I interrupt just 1 minute?
Yeah.
Thank you so much.
Did you have a question?
Lucy, sorry, just 1 minute left, if that's okay.
Oh, 1 minute left. Oh, sorry.
Thank you.
Yeah, this is my last slide. Don't worry. So yeah, I think the last bit, I just wanted to throw out the measurement tools in here, because I think referral data can show us one message, but actually I've chosen a range of qualitative and quantitative measurement tools in response to the outcomes that I said, at the beginning. So I think having a wide range of ways of, mapping how the whole school approach impact we're having on schools is the best way to go forward. It's not the easiest to keep going sometimes, because it is a lot to keep track of. And I'm happy to share examples like our thematic analysis of our visits to schools. We write up reports of those visits, and we can pick out the themes that are coming out of what are the needs in schools and how we're responding. And our most crass method, I guess, at the moment to capture output is we are filling out a Microsoft Office form which has all 8 principles of the whole school approach, and the hours that each member of the team is contributing towards that, and what are the main themes and what are the main conversations that are being had with schools. So we will have a nice range from that method of quantitative and qualitative data coming out of that. And again, children and young people's voice underpins all of the work that we're doing as well, and they are very direct in giving us feedback on what we're doing well in and what we could improve as well. That's me. Thank you very much.
Thanks, Lucy. Yeah, so following on from Lucy's kind of introduction, I would also like to just make the point that I am absolutely not an expert at all in measuring whole school approaches, but I was asked to share what we are doing in West Sussex around looking at the work that we are doing and how we are kind of looking at the impact of that work. So if we can have the next slide, thank you very much. So when we first set up the MHST, we had lots of conversations with senior mental health leads about how they can monitor and evaluate their own wellbeing provision. And we were also having conversations with them about, they kept asking us, what do Ofsted want to see in terms of wellbeing? How can we ensure that we're meeting their criteria? And then also as an MHST, we were having conversations within our team about how we can measure outcomes for the whole school approach. Because we already, obviously, like all the other kind of MHSTs, we already had quite robust routine outcome measures for the clinical one-to-one work, but we knew this was much harder for the whole school approach work. So we wanted to be able to show the journey that schools are travelling with us in terms of their whole school wellbeing provision. And we wanted to ensure that we were delivering good quality support and CPD for our colleagues in schools, and that was meaningful and useful to them. So because of these conversations, which I was having almost as soon as I came into role as the team's advisory teacher, I really wanted to develop something which could support both our service development and also support schools to effectively develop their wellbeing provision. So the first thing we did was set up a working party with a group of our senior mental health leads from a cross-section of our schools from across the county. And we looked at what was already out there, what already existed in terms of kind of monitoring whole school provision and what we liked about it. And we then talked about what they would like to see that was perhaps a bit different to what was already out there. And one of the priorities was they wanted something quick, easy and accessible to use. Lots of them had kind of audit tools sitting on their desks for a long time that they just had never got around to. They also wanted something that could be used by all members of staff, not just by the senior mental health lead, and something that could be used as an organic document that could be very much a living entity in schools, which they could use and we could also use with them to assess, plan and review their wellbeing provision in school. And also we wanted to ensure that all 8 areas of the Public Health England model were being included, as well as taking into consideration the Ofsted criteria and the particular environment in West Sussex. So if we could go to the next slide, please. Thank you. So we also really wanted to ensure that there was enough space for nuance. So we know that the whole school model from Public Health England is really succinct. It gets it down to 8 areas, but actually it covers an awful lot and it can be really overwhelming. So we really wanted to distill each area down to 4 questions. That was kind of the aim. But when we looked at kind of what was already out there, lots of kind of things were using RAG ratings, but we didn't think that really could reflect. There was a lot of difference between a red and a green, for example. So we've gone with a 5-point system that actually allowed a little bit more flexibility, because we felt there was a lot of difference between activity not started and effective provision put in place and ready to share. So we needed some in between scales in there. So this is just an example here. If we take the area of audit and monitoring, we've got 4 questions, which the working party and I felt really did distill this area quite succinctly. I won't talk to the questions, I'm aware of time, but you'll get the slides at the end. Can we have the next slide, please? Thank you. But we had a discussion around the fact that some of the questions are really straightforward for schools, and for others they wanted to go deeper and analyse some of the 4 questions per section a bit more deeply. So I put together a guidance booklet which is supposed to act as a kind of springboard for conversations and allow school staff to explore the essence of each statement. So for some schools, they were easily able to answer the question. So we regularly monitor staff emotional wellbeing and mental health, and we respond effectively to the outcomes. But for others, they wanted to know a little bit more, like what does that look like? What might that feel like in our school? So the guidance booklet then has probing questions for discussion around each of those 4 questions or 4 statements for each of the 8 areas. And the guidance booklet does not have to be used. So some schools, they literally just use the tool itself. They don't dive deeper with those questions. But for some schools, it could really help to get a kind of truer picture of what is happening and what is working for them. I'm going to have the next slide, please. So at this point, we had the reflective tool and the guidance booklet, and the working party felt it was ready to launch really across the wider MHST community of schools. But that wasn't and isn't the end of the developmental work around the tool. And just as we want schools to use it as an organic and kind of living document, we don't want the tool to become static and stagnant either, because we know the landscape around mental health in schools is ever changing, and so should our response to it be as well. So far, if we have the next slide, please, this has included the production of a quick fill 1-page questionnaire for all staff so that everyone can input into the tool rather than just the SMHL and whoever's working alongside them. And then we also have 2 people versions of the tool as well, one for primary and one for secondary, so that their views can also be considered when staff come to fill in the tool. And the pupils versions are designed to be filled out by groups of pupils, so it would be a great activity for mental health ambassadors or school council, or simply just a cross-section of pupils from different year groups. Again, the pupil version is quite self-explanatory. It should be there for schools to pick up and take away and use with school staff leading discussions, but we can also offer sessions with our voice and participation practitioners to lead those discussions with schools, with those groups of pupils, and help them to really consider their answers and facilitate those conversations. We've also developed various training offers on using the tool for those who want or need it. So as I said, it is really designed just to be picked up and used by school staff, but some people were interested in just being able to have access to some training so they could ask questions and just make sure they're using it in a way that it was intended. So we've got recorded webinars on YouTube that can be used, and we've got different webinars for MHST schools and schools that are non-MHST, because obviously the level of support we can offer is different. And there's also an option to join live training as part of our regular calendar of CPD for senior mental health leads throughout the year. And then, yeah, we wanted to be able to share the tool outside of MHST schools, and we are looking at ways we can do that at the moment. So at the moment, it really is being shared on a school by school basis. And I'm sure, like a lot of other people who lead whole school approach, I get a lot of inquiries about what can you do to support us? Why aren't you in our area? And the reflective tool is one way that we can support those schools. And the tool, as I understand, is now also, because once it's out there in schools, obviously it's shared, it's also now being picked up by the University of Southampton, who are using it with their EMHP trainees, and one of the Hampshire MHSTs who are also using the tools. So yes, I can absolutely, I've just seen the message pop up, I can absolutely share. We are really happy to share the work that we're doing. So we do have loads going on around the reflective tool. So this academic year, we've introduced termly meetings, where a representative from the whole school approach side of the team and a member of the clinical team meet with each SMHL in their school to review the work we've done the previous term and to plan the work for the following term. And some schools are bringing along their completed reflective tool to these meetings so that we can identify our support, how it can be utilised. But it is the hope that all schools will fill out or update their reflective tool in advance of these termly meetings so that we can easily look back at the impact the work has had and also look ahead and see what areas of further support they might need. Thank you.
Vic, thank you so much. I think just judging by the chat bar and the reactions, it's incredibly helpful for people to hear about some of these local approaches to evaluating and benchmarking whole school approaches, and absolutely fits in with what Robin was saying about the next phase of collating what people are already doing on this. We're conscious of time, but don't want to squeeze out time to hear about some of these local approaches. So we will hand over to our colleague Anna now. Anna, if it's okay to try to keep to 5 minutes, that would be fab, and then we can try to maintain enough time for the breakout rooms.
Yeah,
as well.
I'll be speedy.
Thank you, Anna.
Hi, my name's no, it's fine. My name's Anna Sims, and I'm from Norfolk County Council. I'm part of the Inclusion and SEND team, working in early intervention and prevention, focusing on emotional health and wellbeing. So I just wanted to explain about some of the work that we've been doing with schools across the county. So these are obviously the components of the whole school approach. If you can move on to the next slide, that'd be great. Thank you. And with the DFE wellbeing funding that was allocated to local authorities last year, and we worked with 100 schools, so primary, secondary and special schools, and we worked with them in groups and individual, and had helped them to audit their current practice in terms of whole school approach and compile an action plan and prioritise actions. So what we decided to use is the Anna Freud 5 Steps to Mental Health and Wellbeing interactive framework, which obviously covers all the 8 component parts of the whole school approach. But because it's a nationally recognised website and has access, gives schools access to resources and guidance, and is updated on a regular basis, we thought that would be a good starting point for this process. So if we could have the next slide, please. So what I did is I basically tweaked the Anna Freud Web's 5 steps to include the component parts of the whole school approach so that schools could understand how it related to the whole school approach. Some of the kind of actions are a bit kind of they don't actually explain themselves in sort of common sense terms. So prepare for change. It's obviously making sure that you have a senior mental health lead. So the schools were asked to allocate, sort of evaluate themselves in terms of these various component parts of the whole, the 5 action plans, 5 steps, sorry, I'm getting myself in a muddle here, 5 steps. And then they were able to kind of evaluate themselves in terms of access of those 5 steps, but also be able to access those resources on the Anna Freud website. So from this point in time, because we had a bit of an issue where we were going to have individual conversations with schools, so I provided this template for them to do, because in normal circumstances what they would do is they complete it online and then they get a report. But in order to be able to kind of share that with me, we kind of comprised this tool, or collated this tool. So if we look at the next slide, and so this example was from a school in North Norfolk, a special school in North Norfolk, who completed their self-evaluation. And what we did was we prioritised certain actions or certain things that were not yet in place, and some of them quite easily to sort because they may be kind of thinking about a policy, and then we also kind of highlighted those things were showing good practice, which we wanted to share with other schools around the county in terms of newsletters or mental health and wellbeing network meetings that we have on a termly basis. So that conversation was really important to have with the school, because obviously using the Anna Freud 5 steps, that is a generic tool kit, but what we wanted to do is make sure that the school was able to personalise it to their context in being a Norfolk school. So making schools aware that there's resources and support that are available to Norfolk schools. But also kind of making sure that we were kind of setting up the structures in place in terms of the school. So having a senior mental health lead, accessing training and support, but also providing the voice of everybody, of the whole school community, by having a mental health action group to kind of take into account all areas of the whole school approach. So from this audit tool, which was done in collaboration with the school, but obviously they could do it on their own, we were able to support the school in terms of making an action plan. So we could have the next slide, please, and this is the final slide. And so the action plan was basically broke down those component parts in a bit more detailed way, so they could actually say what they were kind of working on in specific detail, and also be signposted in terms of support from Norfolk. So I think that's really mine in a nutshell, very quickly. But I'm, if you want me to share any of those resources, and obviously I can't take credit from the Anna Freud website, because obviously that's all their hard work. But we felt it was important that we kind of linked it to something that was very, kind of good practice. Okay, thanks.
Thank you all very much. That was a slightly shortened session, as is often the case for these sessions. But what we'd like to do is, as we said at the beginning, to ask the facilitator from each of our breakout rooms to give a key piece of feedback from their breakout rooms. Can I start with Lucy? Lucy, are you still with us?
Yeah, I am.
Hi, Lucy. Could you just give, just very quickly, in no more than 60 seconds, if you can keep to that, just a key bit of feedback from your group, please?
Yeah, I think it's clear that there's really good work going on in, all MHS teams, and it might look slightly different depending on where we're situated in health education or both. I think everybody's got a really good interest in the whole school approach areas, and then the barriers that come with that is that I guess because the teams all look quite different, there might be different approaches, and then there's different understanding or different approaches to whole school approach. So it might depend on, just like schools, who's leading on that work, and what it might look like and what the focuses might be. I think there was a bit about actually the breadth of whole school approach, and it is a large piece of work, and capturing all the elements of that, and how we can really align health and education. There's quite a few challenges around that, with the data sets or in the tiering systems, really trying to bring consistent language across the both, so it's all understandable, if that makes sense. And then there's the school's individuality, and really finding a place within that, and not being, I suppose, squidged into one section, which is the targeted, monitoring need and targeted support part of, whole school approach, and how we can truly add value and infiltrate into the whole school community, and not being, I guess, communicating mainly with someone in the senior leadership team, and perhaps not having that much confidence that that's then being, infiltrated into the whole school community. And there's high school, turnover as well. So once you get connections with somebody, that might then go. So yeah, I think mainly it's the school's individuality and the team's individualities as well, and how that fits into the bigger picture, and what the role that data plays in that too.
That's fascinating, and quite different to the discussion that we had, which is really brilliant. I think also just really, it feels to me as though that links back to the original ethos of MHSTs, which was that they should be co-produced and should take shape depending on their local place, if you like, and also the findings from our original best practice review and evaluation, which was, as Robin said, that individual school culture really impacted on the way that this work was developing. So how fantastic. That sounds like a brilliant discussion. Thanks very much. Let's move on to Vic. Vic, could you chip in with your bit of feedback, please?
Thanks,
you.
Tanya. Yeah, I think one of the main kind of themes that came out of our discussion was, how do we capture the impact on the whole school community? So the parents, the pupils, everybody, because it kind of came across that we can measure impact to a point, but we can only work with the data that schools are giving us. And two, how do we capture the voices of those parents who don't generally come forward? How do we really know? Because the parents that come to the parent groups and are there, and they come to parents' evening and they engage, we can capture their voices really easily, but that's not going to give us a true picture of schools. So how can we capture those other voices? And some people are using kind of parent focus groups, but again, how do we capture a really good picture of the school in those focus groups? And I think that was just something that came across, like we just need to really find ways to be representative. And also what came across is that different services have very different kind of models as to what the roles are within the service. And actually, if a service is able to have somebody who is employed to look at impact, that's amazing, and then that it's giving time to it, isn't it? It's making sure that impact is seen as measuring impact is seen as important as all the other roles that we do. Yeah, otherwise absolutely. We're just walking blindly, aren't we?
Absolutely. And I think that first point that you made, Vic, around making sure that we're really engaging and seeking the voice of all schools, all children, young people, all parents and carers, and really thinking about how we can engage with those who aren't the usual suspects, if you like. And I know that that's something that we all think about in our work in MHSTs. It's something that we thought about with the best practice review. And I know that Robin, I can't see him, he's got his camera switched off, but I'm sure he's nodding and that he'll be thinking about for the work going forward. So thank you for making sure that that remains in our heads. He's nodding. There we go.
Thanks, Robin.
Thanks, Vic. That's brilliant. Becca.
Tanya, and I was in Robin's group and there was a lot of nodding, so I can
always.
The nodding. And actually I was going to start with that very point. So yes, absolutely, it was raised in ours about how we seek the views of all voices and that they're representative, that's as you said, of schools, children, young people and their parents. So yes, absolutely, that came out clear in ours. I think the key for me was that people are finding their way around measuring impact. We're at various different stages. There's some brilliant examples of where people are starting or kind of more established. They're all different, no consistency and no standardisation, but starting a journey. I think Robin's point, I just want to articulate, I don't think we got into the crux fix, there wasn't time, but the question about how do we seek those voices? Can we work in partnership with other surveys or questionnaires that are being done, particularly from our public health colleagues, maybe, or for our health colleagues within schools, health and wellbeing surveys, etc. We all know and love them. Can we look at what's already out there? Can we work with those as an example?
Thanks, Becca. That's brilliant. More nods from Robin. Thank you very much. I'm going to move. I'm very conscious of time, so I'm going to move very quickly on to Liz, who I think were the facilitator for our final group.
Oh, hello, I'm here. I can't turn my camera off. Oh, I've done it. Yeah, I'll try and keep it brief. We had a great conversation about the great work that's going on and the similarities between the kind of mapping tools, the audits, and these are great resources to focus attention for schools to look at what they need to prioritise. One of the barriers that we all kind of agreed on was that sometimes language can turn schools off and not engage them. So the word audit has come up quite a few times. So one of the people in my group spoke about the wording. They called it emotional wellbeing reflection tool. I hope I got that right, Tyron, because I was scribing and facilitating in our group. And I think the other thing that was a really strong theme to me is about really selling this to schools to lead. So, the senior mental health lead really should take that leadership. They are the gatekeeper to really engage in those key stakeholders like the children in their schools and the parents. And a lot of the things that have been mentioned as a way to measure the impact are time consuming. So, you need to get a baseline and then the surveys that follow on. There needs to be somewhere to show that information goes somewhere. So I suppose it's about what are they doing this for? Where is it going? And we had a really great chat about that.
Thank you very much, Liz. That sounds great. And it's I obviously get the joyful job of feeding back last from the breakout rooms, and you've all said it already. But I will obviously take up my minute as well. Very, very quickly, I think that there's some really great work going on in Kent where they've managed to piggyback on previous work undertaken by Head Start. So that's one I'm kind of making a mental note for us to go and find out about that more. the other kind of examples that were given were really, I think, were really great in the way that people were just saying we do this naturally. We're always collecting data about everything that we do, and that felt really important. And in a kind of natural plan, do, study, review cycle. So that kind of cyclical review. I really love PDSA as a kind of service improvement methodology. I bang on about it at every opportunity because it's so easy and simple. Schools use that kind of approach very much in terms of developing work as well. So I think that that's kind of, that there are some really simple things that we can do and that we are doing, and don't let's forget all of that. The counter to that is barriers from our group, where the time that it takes to collect and record all of this, and that if we're spending a lot of time filling in forms and collecting, writing down what we're doing, then that takes us away from actually doing the doing. So that's often a tension, isn't it? And then differences in school engagement, and that can then create a kind of bias in the impact, if you like, that some schools are so not engaged with our work, and they may be doing work, but we're not managing to collect the data on that work, and so then that kind of creates a bias within. So I think that brings us to the end of my section. I'm going to hand over to Becca at this stage. Thank you all very much for contributing, and just to really reiterate, we will be collecting the notes from the scribes and feeding that in to the next stage of the project, which we're all so excited about. Over to you, Becca.
Thank you so much. Thank you. And before I just hand over the final baton to Jess and our fabulous colleagues from DFE, I just want to say a huge thank you from myself, from Robin and Tanya too. We really appreciate all of your input. So my job now is to just tell you about the next steps. So we're really delighted that we have funding committed to take this piece of work forward across the south east and east of England. We hope to do this within the next 6 to 8 months. Robin kindly has agreed to work with us, so we're delighted, because he is our lovely, brilliant mind of helping make this a reality. And also West Sussex County Council have kindly allowed Tanya to help us project manage this piece of work. So we're equally as delighted with that. So what we want to be doing is working with you to start to collate the activity. This is a great start, so thank you so much. To co-produce an agreed approach, and then to pilot it, as Robin said. So we'll be coming back out to you to see if you're interested. Please ping us, put something in the chat if you're interested in working with us on this. No guarantees, but we were really keen to work with you, so do let us know. I think the other thing to say is that we've got a huge appetite for this nationally, and what the best practice review that we did, we were able to input into the national operating guidance for MHSTs, and there was a limited reference to whole school approach. Robin and Tanya were very keen to make sure that was a reality. So we know that this is going to be useful for you to ensure the sustainability of MHSTs going forward, and being able to measure the fantastic work we're doing around whole school approach. So that's a thank you from me. Thank you to everyone that's come today. And I hand over the baton to you, Anna, and to you, Jess. You've been delightful to work with as part of this. Thank you.
Thank you so much, and thank you everyone for attending. We just have a few thanks. As you can tell, it's been a huge group effort to pull this session together this morning. But firstly, thank you to everyone for joining us, for giving up your time this morning, and for engaging in the discussions really well. We hope you agree it's been a really exciting and thought-provoking session. And I know it's a topic that lots of you have been really eager to discuss together over the past number of months. So yeah, it's really exciting to have got together and had this opportunity. Just wanted to thank our presenters, particularly to Professor Robin Banerjee. Thank you so much for agreeing to deliver our keynote this morning. Also a few thanks to the rest of the team, so to Gavin Lockhart, Laura Wixton, Lucy Hill, Vic Mackin and Anna Sims, and then of course to our brilliant organisers Tanya Proctor and Becca Randall. It's been great to work with you over the last few months, and we look forward to everything that is to follow. And thank you also everyone who kindly agreed to facilitate or scribe for one of our breakout rooms. That's a really, really important job. So thank you so much for your help with that.
And just to confirm, I think you'll see in the chat that we will be circulating the slides and also a recording. So please do share that with any colleagues who couldn't come along today. And just, yeah, a huge thank you again. You can see from the chat, it's obviously been an incredibly useful session, as it has been for us. So thank you so much, everyone. And we'll draw it to a close there. So have a great rest of your day and see many of you soon.